When you near the end of pregnancy, it's time to start thinking about packing your hospital bag, but it can be really confusing and you may not know exactly what you need. It's actually helpful if you pack 2 bags, one for labor and delivery and one for your postpartum experience, because in many hospital situations, you deliver in one room and you're transferred to another. And so you can just bring your labor and delivery bag with you for the labor experience and leave everything else out in the car until you actually need it, so you're not packing everything around twice. For labor and delivery, the most important thing you need is a camera. If you don't have anything else, just make sure you have that, because you can't get those photo ops back. Beyond that, you might want some chapstick, some old socks that you can throw away when you're done because they might get a little gooey, cell phones, chargers, and also snacks for dad. Beyond that, it kind of depends on what your goals are for your labor experience. If you're planning on an unmedicated delivery, you'll want to bring things that will help support you through it, like a birthing ball or music or lotions, those sorts of things. But if you're planning on just getting an epidural, you'll need something to entertain yourself with, because you might just be sitting there for hours on end with nothing to do. So most couples bring like a laptop and some DVDs or cards to play card games, or sometimes just a good old book, something to pass the time away. This is a very good time for couples to bond. So if there's something that you guys like to do together, bring that if you're planning on getting an epidural. For mother baby, pack like you're just going to go to a hotel for a few days, and the items you bring won't be much different. Of course, you'll need toiletries, things like toothbrush, toothpaste, comb, brush, deodorant, shampoo, conditioner, soap, all of those sorts of things. And as far as clothing items go, bring something that you wore when you were about 5 to 6 months along, because that's what you're going to look like after you have the baby. Your uterus doesn't automatically shrink back down, and so you still kind of look like you're pregnant when you leave the hospital. So do yourself a favor by not bringing your pre-pregnancy pants to the hospital, and you'll feel way better about yourself. As far as tops go, bring something that's loose and conducive to breastfeeding. So that might just be like a really big t-shirt or nursing bras. Those sorts of things are always good. Maybe pair it with some sweats and some slippers. So basically, if you bring a few comfy outfits, you should be prepared as far as yourself. Now, when it comes to baby, the hospital provides a half onesie and blankets, but if you want to dress your baby in clothes you've purchased or bring your own blankets, that's totally fine. But the hospital does provide diapers, wipes, pads for you, and all the medications that you need while you're there. And that brings up another good point. Don't bring home medications to the hospital with you, because that increases the chances of things interacting or of us giving you 2 of something. And you don't actually save money by bringing your own prescriptions from home. And for sure, make sure you have a car seat for the day you're going to go home from the hospital, because the nurses will want to watch you put your baby into the car seat and make sure that they're properly restrained before you leave. Also, one other thing to bring to the hospital, and you'll want to have it for the entire stay, is your picture ID and your insurance information. Even if you pre-registered, the hospital may want to verify a few things or may have some questions. Congratulations ahead of time on the birth of your baby, and if you have any questions for me in the future, feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.